So my name is Michaella. I'm a nutritional therapist. I'm a BANT registered nutritionist, and my main areas of clinical work include hormonal health, post-viral and chronic fatigue, thyroid and autoimmunity, and I also work sort of across the body, IBS and skin, hair, that kind of stuff as well, very very frequently. Um, I originally became interested in nutrition because I had a chronic fatigue and pain condition called fibromyalgia, and changing my diet is what helped me recover after I tried lots of different medications and things like that. And so I would say that's what kind of got me interested in nutrition, and what keeps me interested is that I have two hormone conditions. One is called PCOS, and the other is called endometriosis. These are conditions which affect roughly 1 in 10 women each, and I am genetically blessed enough to have both of these conditions. So because of that, I work with the hormones each and every day. I work with menopause very, very frequently, as well as just hormones in general and fertility and post uh, postnatal and things like that. But because I have chronic conditions, I have quite a balanced approach to nutrition, because I feel that maybe it might be amazing for whatever the condition is to be super strict, and maybe it's dairy and gluten and sugar and alcohol and caffeine and all these things are off the table. However, most conditions or most things we go through with our health, they're not just for 2 weeks or for 2 months even. Sometimes it's for a longer time than that. And so the way that we manage these conditions need to be in a way that you can keep it going. So my approach is to try and be sort of balanced between, okay, this is what I need to do to feel good and to feel better, but I need to have some softness and some flexibility within what I'm doing. So for example, within my own health, I know that gluten is a big trigger for me with my endometriosis. So that's my main thing, that I'm, 80% of the time I'm gluten-free and, try and keep dairy under control. But I do have times when I allow myself to have those foods. So it's the same thing with managing menopause. It's something that takes many years to go through perimenopause. And then when you're postmenopausal, there are their own symptoms to manage. So tonight we'll be talking about kind of an overview of that, but really how to try and manage these things in quite a gentle and relaxed way. And then we'll also be talking about how perimenopause and the hormones relate with other areas of the body, things like skin, gut, your nervous system. These are all affected by our hormonal balance or change, and certainly sort of looking at those things individually is really important as well. And then we're going to get into that this evening, because I really try when I work with people to not get too caught up in the diagnosis. And what I mean by that is that you are not perimenopause, you are not menopause, you are whatever your name is, and you have a unique set of needs and symptoms within that. And so trying to work on that individual level is really important when it comes to managing things, because it's not a one size fits all for anyone in any condition at any stage of life. So we're going to talk about those individual differences this evening. So an overview, we'll talk a little bit about what menopause is, a brief overview of hormones in the rest of the body. So thinking about the liver, the thyroid, adrenals, and the gut. And then I'm just briefly going to touch on a few cases and protocols that I've done in the past. We'll also talk a little bit about hormone disruptors, diet, and lifestyle. So what is menopause? Menopause is actually a 1-day occurrence, which is quite strange to think about, but it is a point in time, 12 months, where it's been 12 months and you can look back and say, I haven't had a period in 12 months. So menopause itself is actually 1 day, and perimenopause are all the years leading up to that point. So for some people that can last all the way up to 14 years. And in many cases, actually, it starts, quite young, sort of in the early 40s, people can start to have perimenopause symptoms, and they're maybe not aware of that. That's what was going on until they're postmenopausal. But it most commonly starts at age 45 and can last for quite a long time. There are other things that can cause menopause apart from just aging. So we can have surgical menopause, where we've had a surgical removal of the ovaries, or if someone has had a hysterectomy. And I definitely work with that a lot. Like I said, I have endometriosis, so I very frequently work with women who maybe have really severe endometriosis or adenomyosis, and they've had to go through a hysterectomy to manage that. And then some medications as well cause a chemical menopause. Again, that may be as in an effort to manage a hormone condition, but that does induce a menopause as well. And I've had some people who are in their 20s who are going through a chemical menopause. So it's not just sort of those in their 40s who can be affected by this hormonal shift. So there are many symptoms associated with perimenopause. You may have some, you may have them all, you may have more than what's on here. These are the main ones. So we get hot flushes, change within the cycle, changes to periods, so the heaviness, reduced libido, vaginal dryness. But then we can start to have other symptoms, which people don't typically associate with perimenopause, yet they are due to menopause largely. And if not directly from the hormone shift, then perhaps from the impact the hormone shift has on other areas of the body, for example, the adrenals, and we'll go through that later. So some of these include things like fatigue, depression, or anxiety, sleep issues, weight gains, headaches, heart palpitations. So these sometimes don't come necessarily from exactly that hormone shift, but it can be coming from how that hormone shift is now affecting another part of the body. So there are some things which are considered red flag symptoms. So these are something that if they were reported to me as a practitioner, I would have to refer them to the GP to rule out other causes. And again, this is that thing about not getting bogged down into, okay, I have perimenopause, so every single symptom I have must be to do with that. Yes, maybe many of them are, but we want to make sure that you're not sort of, overlooking anything. It's really easy to do this. I always use this example when I had fibromyalgia and I was really in so much pain, had to all the time. And I was at the doctor's getting blood tests, and I said to my GP, "Oh, I have this funny rash on my side. Can you have a look at it? And, I think maybe I'm allergic to something." And he had a look and he said, "Michaella, you have shingles." And I had no idea I had shingles. It was because I just thought, well, I'm just in so much pain, I'm flared up. So sometimes that can be the case with perimenopause, where you sort of, you're having these different symptoms. And so you suddenly have headaches, or maybe you have hot flushes. And so you're thinking, oh, it's just to do with that. But sometimes it can be that maybe there's an iron deficiency as it developed, and that's causing the heart palpitations, and that can simply be supported by increasing the iron in the body. So a brief overview on your hormones. So you have progesterone, you have estrogen, and estrogen is made up of different metabolites. So estradiol is the most active form, and this is one that's most often given with HRT. And then you have two other estrogen metabolites as well. Excuse me. And then you have aromatase, which is an enzyme that converts testosterone across into estrogen. So I really like to say nothing in isolation. So this is a good example where we would see what's above the surface, and it's just a little tip of the iceberg. So we have overall hormonal health, and that could be how we feel, and we have all these symptoms associated with that. But what's underneath the surface are many things combined that drive things. And this is really where we're very unique from person to person. So I may work with two women who have maybe they're the same age, they're both going through perimenopause, but maybe for one, the adrenals and the gallbladder is really significant, and for the other, that's not such a problem, but they have blood sugar dysregulation and loads of digestive stuff going on. So that's where getting into the unique differences can be really helpful. Now, this is what normally is happening across a menstrual cycle. And sometimes when you take HRT, you're given it to try and mimic this pattern here. So generally speaking, across a period, everything's very low, or estrogen and progesterone. And then you go to ovulate, and the estrogen has this big jump. And this is where you would see that change in cervical mucus, this kind of egg white cervical mucus. And then and actually we normally feel quite good during this time. You have good energy is usually an increase in focus, concentration, libido, all this kind of good stuff. And then it drops right down, and it's such a quick drop. I mean, these are only a few days apart, and you go from way up here to down here. And for some people, this can really feel very, very significant during perimenopause, this and maybe in all the years leading up to it as well, this big shift from one extreme to the other. And then the progesterone takes over, which is the purple color here. And this is called the luteal phase. And some people find the luteal phase quite tricky. And then we can see things like constipation and bloating taking place during that time. And sometimes when people are taking HRT, for example, they might find sometimes they have difficulty with the symptoms, trying to get the HRT right. And often when I'm working with people privately who are taking HRT, which I work alongside quite comfortably, I will encourage them to, go back and maybe ask for it to be reviewed and to change the dosages around. And, it's a little out of my remit, but really trying to work with them with their HRT to make sure that what they have going on is right for them. And sometimes how you have felt previously before perimenopause can be a good clue as to maybe how you're reacting to your HRT, if that makes sense. But this is, pretty significant from a mental health point of view, because estrogen is tied up with serotonin, which is your happy hormone, and progesterone is tied up with GABA and dopamine, which are our reward chemicals and our sort of calming ones. So you think with menopause, and particularly perimenopause, postmenopause, sorry, when these hormones all become very low, then that can start to affect how we feel with our mental health. And I would say it's not, you haven't changed yourself, it's just hormonally things are different. And that I think is quite validating. Sometimes I know with my own hormones, if I'm kind of at this point here or just before a cycle starting and everything's very low, I might feel more stressed or feel more anxious. And I can sort of say, okay, well, it's a hormonal element here. And that is helpful for me anyway, to know that that's sometimes what's driving the way I'm feeling. So the thyroid's a really important part of our just general sense of well-being, and it's a butterfly-shaped gland in the throat. It's involved in energy production, weight management, skin and hair, and also it affects digestion, and it is tied up with hormone function as well, sex hormone function. So, with the thyroid, this is something I test. I would say I'm looking probably at thyroid results every single day in my clinical work. And the reason being is that the reference range on the NHS is very broad for the thyroid, and very often people are sitting in a level which is technically normal. They don't need to be medicated, but they're definitely feeling that all the symptoms of low thyroid. They're having dry hair, skin and nails, hair that's breaking quite easily, their mood is low, their energy is low, they're gaining weight or they're not able to lose weight. And maybe they're having, if you're still bleeding during that time, having heavier periods as well. So the thyroid's very significant, and it has a sharp relationship with the sex hormones. A good example is that sometimes when people have a baby, they have a overactive or underactive thyroid right afterwards. It's because that big shift in hormones can sort of trigger change in the thyroid as well. Then we have these things called adrenals. Now, you may not have heard of them, but you certainly know them. Your adrenal glands are these little, they look like little hats, and they sit on top of your kidneys, and they basically have something called the HPA axis, which is more or less how we respond to stress. So you have the trigger of stress coming in, maybe that is work or home life, and then there's a communication that happens between the hypothalamus and the pituitary gland, which then tells your adrenal glands, okay, something is happening, you need to start producing cortisol. Our bodies are very, very dramatic with how they respond to things. Every trigger of stress to our body is, okay, maybe we're about to be physically in danger. We need to release cortisol. We need adrenaline, even if it's just work stress or you missed a train or something like that is going on. It doesn't matter where it's coming from. The body always goes to the worst case scenario, and you go into what's called fight or flight mode. And when you're in fight or flight mode, because the body's thinking just purely about survival during that time, you'll start to prioritize that, and things like digestion and your sex hormone function and your immune function go on the back burner. So for example, with digestion, you literally send blood away from the stomach to your arms and legs so you can make a run for it if you were in physical danger during that time. And that's okay here and there, but when we spend lots of time in fight or flight, as so many of us do, then we can really start to see, changes in how we feel. And, this really starts to be quite significant during the hormonal shift time, because the adrenals are also involved in creating something called DHEA. Now, you kind of look at this image and you see DHEA, which is involved in sex hormone production, and cortisol. These are the two jobs. But when you go through menopause, your ovaries are saying, we're done. We don't want to make estrogen anymore, really. Someone has to do the job. So your adrenals have to do this job. And it's kind of like if you have your job and you know how to do it really well, and you've been doing it for years, and then now you have to do my job on top of your job. And that's an added stress. And so we can feel that within our biological response and just how we feel with our stress sort of tolerance almost. And again, there's nothing, your personality has not changed. You're not any less strong than you used to be, but perhaps there's this hormonal element that's really impacting things for you. So I almost always work on adrenals when I'm working with perimenopause, postmenopause as well. The other thing that triggers an adrenal response and turns on the HPA axis is inflammation. So, I mean, very, very, very rarely do I have people who have absolutely no life, work, home stress, very relaxed, everything's really like cruisy, but they maybe have an inflammatory condition. So there might be rheumatoid arthritis going on, or they've had an injury they're recovering from, or they have some sort of autoimmune condition where there's lots of inflammation going on. And that's going to be triggering that stress response in the same way that it would be getting triggered if there was external stressors as well, in which case we need to think about sort of soothing and supporting the inflammation side of things as well. And things like dietary triggers, if you have an allergy and you're mounting an immune response to that, that can potentially be causing a stress response as well. So the gut is quite interesting. Your gut, I love telling people this because I think it's really horrifying, but it puts the point home that the digestive system from head to toe is the size roughly of a tennis court. So it's absolutely massive. So what's happening in the digestive system is going to affect many other parts of the body. And we have a big relationship between the gut and mental health. There's a two-way relationship there. There's a relationship between the gut and the skin, and then also between our hormones. So we make nearly 90% of our serotonin in the gut. About 80% of our immune system lives in the gut. And also there are studies coming through showing a relationship between the microbiome and things like blood sugar management and weight as well. So it's a pretty significant area to think about. And often I'll see people when they go through menopause, they start having difficulties with digestion, as well as finding difficulties with things like gallbladder function as well. And the gallbladder actually, interestingly, is also involved in breaking down and managing hormones. So the liver is something to think about too. And this is quite interesting because even when you have sort of low levels of estrogen, because maybe you're postmenopausal, you still want to think about how you're then managing your hormones, because once you've finished up with estrogen, you make one of three pathways. You go down one of three pathways to make one of three estrogen metabolites. Two of them are reactive, and one is protective. So the reactive one is 4-OH and 16-OH, and the protective one is 2-OH. So when we go down these reactive pathways, if we don't have enough natural antioxidants in the diet, which we'll talk about later, then we can start to become quite reactive, and we start binding them to DNA and causing some oxidative stress and damage, which is not great for us. So thinking about what we can do to support the liver is also helpful during this time, and I'm going to touch on that later on, but that is something to think about. This kind of scary looking image here is from a hormone test that I do in my clinical work. So some of the common sort of complaints, difficulties with within menopause, and sort of how I usually approach supporting them. So we have hot flushes, which obviously can happen all day. So again, it's something to think about seeing the GP about, but about 75% of women going through menopause will experience hot flushes, and they happen due to the changing level of estrogen. And again, this is something I see in people who aren't going through menopause, and it's because of the low levels of estrogen or high levels and things are moving around. Supplement wise, Be maybe thinking about some herbal support, things like sage and hops usually are my go-to. You need to be careful with sort of taking any supplements off the cuff if you're on any medication. You need to make sure you're sort of checking through that with someone. But that's sort of one of my things that I would usually try and support. Vaginal dryness is a big issue and very, very uncomfortable, and also not great for the immune system of the vagina, because the cervical mucus there is a big part of your immune system. I mean, you think about when you have a cold and you start producing lots of mucus to sort of get rid of that pathogen. And it's the same with cervical mucus, is it's there to sort of help offset things like thrush and BV from setting in. So it's not just about the sort of sexual intercourse side of things, it's about the immune system too. And it's driven by change in hormones. And then also the vagina shortens and can lose some elasticity. There's a probiotic pessary I quite often like to give to people to take. Dietary point, we're thinking about lots of omega-3 fatty acids and flax seeds and staying really hydrated. But there is a lubricant which I quite often recommend people use on a day-to-day basis, which is hormone friendly. There's no parabens in it, and it's the same pH as the vagina, which is great. So it's not sort of going to be throwing anything off in that way. So it really supports the immune function in that area too. So I can share the information of that later on if anyone is interested. Reduce libido. So again, this is a lot to do with spending more time in fight or flight. So you think if you are in fight or flight mode, the body's not going to be thinking about you procreating. It's thinking about trying to get you out of, remember that dramatic response of I'm being chased by a tiger or a lion. So your sex drive is going to be reduced from that aspect. And then obviously we have a change in the sex hormones. We can have the vaginal dryness. We have increased anxiety. Of course, the sex drive is going to be low during that time. So I mean, maybe some people have that response to stress, but I think most people do not. So again, when we're thinking about that, this is where when I'm working with someone, I'd be thinking individually. If you're going to be trying to sort of support things yourself, then you would need to be thinking yourself, do I have vaginal dryness? Do I have increased anxiety? If the answer is you have increased anxiety, then you need to be thinking about your adrenals. In general, for supporting the libido, I'd be thinking about, again, those nice omega-3s. What I've put here is sort of driving and supporting the vaginal dryness side of things. And we'll talk a little bit about more the adrenal health side of aspect a little bit later on. Weight gain, something that happens quite often with hormonal shift. And one of the really big things with weight is around blood sugar balancing. So head to toe, you only really need 1 teaspoon. It doesn't mean you can't have more than 1 teaspoon, but that's all we really need. So when we go above 1 teaspoon, we start to put the sugar into the fat cells for storage. And then when we skip a meal, because maybe you're fasting or you're exercising on an empty stomach, or you're not eating anything till 10 in the morning, you're skipping breakfast, what happens then is that your blood sugar plummets and the body's thinking, okay, this body fat I have is liquid gold. I do not want to let it go for an emergency. I'm going to use up the muscle instead. So you actually start to eat into your own muscle to get energy. This is not great from a stress perspective, but it also doesn't do you any favors with your overall metabolism. So when we get through the 30s, usually the lean muscle mass starts to decrease, and it's actually the lean muscle mass that helps us keep our metabolism high. So thinking about blood sugar support, which is about eating protein and fats when you have sugars, and getting enough protein in, but also thinking about weight-bearing exercises to build up your muscle mass. So not sort of like hammering your body with cardio, but actually thinking about weights and more of that resistance sort of training. Again, the gut microbiome is definitely something to think about, and maybe the thyroid as well. So this is where we start to get to those really individual differences, and perhaps the thyroid is something that for you is really significant, but maybe for your friend is not significant. So that's where we start to get into those more individual things. But for everyone, we'll be thinking about weight-bearing exercises, blood sugar balancing, and with adequate protein. Anxiety and insomnia. So again, anxiety is something that is a really big struggle across the board. I would say anyone with hormones that are moving around as much as we saw in that chart I showed you. And then what happens during peri-menopause is that usually the cycles get shorter. So your hormones are being waxed and waned even more in like such a tight time period, instead of it being over 4 weeks, it's all happening to you in just 3 weeks, or sometimes even less than that. So no wonder we feel anxious during that time. But then equally, when we're postmenopausal and the hormones are low, then we can start to feel that effect too. So across the board, I would be thinking about blood sugar balancing. I have listed some supplements here, but again, you need to be sort of careful with that if you're doing it on your own, particularly so with the one called ashwagandha, which I see everywhere at the moment. It's very popular these days, and it's not something I would use if there's any autoimmune conditions, so just be aware of that. But things like blood sugar balancing and the B vitamins and zinc and magnesium are usually pretty safe bet for most people. With sleep, blood sugar balancing is super important. And actually, your blood sugar can get really, really low at around 2, 3 in the morning. And for some people, that causes them to wake up. And when you wake up, you don't necessarily feel hungry, but that's why you've woken up. And because the blood sugar has dropped, now you're into the muscle to get energy, and that puts your cortisol up. So you can feel actually quite awake during that time. So tonight, what I'd like you all to do is have a little snack before bed and see if you sleep any better. So the type of snack that I mean is something that has that slow releasing carb and also has a protein or a fat to stop it from releasing too quickly. So what I normally do is maybe I have oat cakes with some nut butter, or like a little piece of sourdough with again nut butter on it, or you can do a small bowl of porridge with some nuts and some seeds in there. You could do some hummus and crackers, that kind of thing. So try that tonight and see if you notice a difference. I think that you will. But then also thinking about, limiting your screen time, and thinking about having a consistent bedtime. I think with children, how important their nighttime routines are. And we're actually not that different as adults. We just don't have anyone telling us what to do, unless you work with me, and then I'll be telling you what to do nicely, but I'll be telling you what to do. So, keeping those strict timelines can be really important there as well. And then thinking about magnesium, vitamin D are also really important with our sleep hormones. Brain fog. Again, brain fog is really common. We can have a shift in hormones, increase in cortisol. And so sometimes thinking about that, we would be trying to get in the B vitamins, and then some more individual herbs. Things like ginkgo has been used for a long time with supporting cognitive function. Vitamin D is important, and obviously having a good sleep. It's really hard to have a good day if you've not had a good sleep. So for most people, I start with sleep and make sure that's feeling really, really strong. And then we start to see, okay, now do you still have really bad brain fog? Yes or no? And usually the brain fog is really lessened once the sleep is better. So I'm going to just touch on hormone disruptors, and I don't do this to sort of like scaremonger or anything like that. It's more just about educating and understanding that what a endocrine disruptor is, and what we can do to maybe reduce a little bit of our exposure on our day-to-day lives. So it's technically an agent which interferes with the production, release, or transport, metabolism, binding, or action of a natural hormone in the body. So that would be maybe something that binds to a hormone receptor. So parabens, for example, we get parabens and lots of different cosmetics, and they bind onto the hormone receptors, and then can sort of interfere with the natural rhythm of things. And you get some stuff in like soft plastics, in herbicides and pesticides, that sort of things, and in dairy as well. It's quite high amounts of estrogen, and then we get dioxins in the fatty tissues of animals. So it's not about never eating a piece of meat ever again in your life, never using makeup ever again in your life, or, cling film or anything like that. What I normally say is just try and do one thing at a time. So when your deodorant runs out, maybe you get a natural deodorant. When it's time to replace your non-stick pans, maybe you get a ceramic pan, like a green pan or something like that instead. Don't buy cling film when the next time you've run out. Buy maybe the like brown paper or brown paper bags to store things, and that sort of thing, just sort of slowly over time. But the soft plastics are something you can try and phase out. So reusing takeaway for when you reheat them is not great. If you want to recycle and use them again, use them to store, I don't know, paper clips or something, but don't reheat them, because the heat releases out small amounts of those plastics, and then they interfere with your hormones. So there's just lots of little things you can do over time, but I always say don't have to do it all at once. It can happen just slowly, and making gradual changes there in amongst everything else. Now, investigation. So I've kind of been touching on a few things as we've been going along. And I very, very often will do testing in my clinical work. It really enables me to understand the individual differences with someone and also to monitor conditions or keep an eye out for conditions potentially developing. So obviously hormones, if you think that you are perimenopausal, but you're not sure. Stool testing can be really useful for some people if you're maybe struggling with the weight side of things. If you have skin stuff that's come through, sometimes we get acne during hormonal shift. The thyroid, I do cortisol testing, which is quite interesting. It's sort of done at multiple points throughout the day, so we can see how it's moving up and down. Iron, cholesterol is actually especially important with postmenopausal people. Vitamin D and CRP. CRP is your inflammatory marker, so that can be really useful to have a look at that and kind of see what's going on that side of things. So I've kind of listed off symptoms here and associated them with what maybe I would be thinking about with someone. So cortisol, I'd be sort of thinking about that if there was headaches, aches and pains, heart palpitations, if we've ruled out that iron isn't an issue. And FSH, if you're sort of thinking that there's maybe a change to the cycle and you're sort of wondering, is there any perimenopause sort of stuff going on there? And then the thyroid, anytime someone's talking to me about irritability and depression, weight, as changes with their skin, I will always think about that. And iron as well. So the reference range for iron on the NHS is 15 to 200. It's absolutely massive. And I cannot tell you how many people over the years have said to me, oh, I've had my iron checked and it's fine. And then I'll see their results. And actually it's been checked at multiple times and they've been at like 17 or 18 or 19 out of 15 to 200 for years on end. And, that's not sort of been, brought up. And I like people's iron to be much, much higher than that. So definitely that's something to think about there as well. Now, here's some foods which I'd like to try and get into the diet. Now, Mediterranean diet, and I'm not just saying this because my family's Italian. I mean, maybe a little bit, but a Mediterranean diet does have a lot of really nice components to sort of match up with what we've spoken about. So a lot of these omega-3 fatty acids, like oily fish, olive oil, avocados, there's lots of nice protein in there. There's some whole grains, there's some dairy, some wine, so you can still have these kind of nice things throughout that you want. And it's not too super restrictive, but it's got a big emphasis on these omega-3 and like anti-inflammatory foods that you'd get within the Mediterranean diet. Things to maybe limit. So alcohol, red meat, sugar, and caffeine. I usually find with alcohol, it's red wine and beer, which are the worst, and caffeine because of the histamine element. And for many people, when they go through hormonal change, they find that they have difficulties with with sort of like getting itchiness. They're getting rashes, and it sort of almost feels like a hay fever response. And it's because there's changes happening with the histamine. Again, with histamine, maybe we'd be thinking about the gut instead of just like long-term avoiding these foods. But in the short term, maybe avoiding those and then working on the gut and the histamine breakdown could be really, really, really helpful with people. And then sugar as well. I mean, sugar can throw off the blood sugar balance. You don't have to have no sugar. It's just about how you do that, and allowing yourself, I suppose, the opportunity to see how you feel when you have less sugar, see if you feel better for it. Sometimes that makes it a little bit easier to keep it lower, but you don't need to be completely sugar-free. Don't worry. But just maybe limiting it a little bit. And then the gut. So with gut health, maybe you've heard of probiotics. So that would be like you can buy probiotics. Obviously, you can get it in food, so food which is fermented. But then we have prebiotics, and these are sort of things that feed the bacteria. So leeks, onions, oats, garlic, they're all really good examples of prebiotics. So trying to get some of those through could be really helpful as well. Omega-3 fatty acids, I kind of touched on those with the anti-inflammatory diet. Any of the oily fish kind of fall into this category. So salmon, anchovies, mackerel. If you don't eat fish, then maybe walnuts, avocado, olive oil, they're all kind of come into that omega-3 fatty acids category as well. Brassicas. So brassicas are a family of vegetables, and they help with that hormone clearance side of things, going down more of the protective pathway that I mentioned. So Brussels sprouts, cauliflower, broccoli, kale, cabbage are all in that family. And then we have other things that can help with just overall hormone balance. So lean protein, eggs, chicken, turkey, and beans, things that have something called inositol in them. So inositol is not just helpful for your hormone balance, but also for your blood sugar response and for converting your T4, which is your active form of, your thyroid hormone, T4, into the active form called T3. So you need inositol to do that. And outside of beans and pulses, you don't really get that much of it in food. So that can be really helpful with that. And even if you take thyroxine, it's worth thinking about trying to get more beans in for the inositol, because when I work with people who take thyroxine, I will say, well, we still need to look at the T3. And sometimes I'll see that the T4 looks like a good level, but the T3 isn't good because they're not converting. So top line, they look like they have the thyroid's being well managed, but actually they're not really converting the medication that well. And so sometimes we need to think about what's involved in that conversion. There are other things than just inositol, but inositol is a big part of it. And then lifestyle as well. So walking, yoga, swimming. So we're again trying to think about those adrenals and not being too pushy with things there. Massage if you can, acupuncture if you can. Reflexology is also very nice during that time as well. I also should touch on soy products. So there was some research done on a group of women in Japan, and it looked at how they experience menopause versus women in Western countries, and they experience it very differently. They have very, very minimal amount of symptoms, and the idea behind why is because of the amount of soy that they have in their diet. So soy and flax seeds are phytoestrogens, which means they're plant estrogens, and they can bind onto our hormone receptors and interact with them for even when you have gone through menopause. You have estrogen receptors which are active for 10 years after menopause. So if you're postmenopausal, it still is relevant. So trying to get some of that unprocessed soy can be really helpful. Edamame beans, for example, or if you like tofu, you could eat some tofu. But that was the main difference in their diet versus the Western diet. So that's something to think about. If you're getting flax seeds, don't waste your money on the expensive pre-ground flax seeds, because the phytoestrogen property, the omega-3s have gone. They start to degrade after 15 minutes, unfortunately. But the good news is that buying whole flax seeds is significantly cheaper. I think it's about 5 times cheaper than buying the pre-ground ones. And you just put them into a smoothie and then you're set. Okay, so briefly, a few little case studies that I've kind of worked on just to give you an idea. So this was someone who was 42 years old, presenting with weight gain, bloating, increased depression, low energy, difficulties with sleep, and a change to cycle. So periods are more frequent and heavier. So 42 years old, if you're thinking maybe there's a shift here, maybe there is perimenopause, but I didn't want to group under the symptoms of perimenopause. So we can see bloating, and yes, that can be hormonal shift, but it can also be a food allergy. There can be things like SIBO going on. There can be difficulty with digestion. And where is that coming from? Is it because of stress? Are there nutrient deficiencies? Is the microbiome, so the balance of bacteria, is that sort of not quite right? And yeah, things like allergies. So usually with that, I will really try and get underneath all the symptoms and trying to understand where it's coming from. And again, not just having that label and saying, okay, I have perimenopause, so every single change in symptom I've had has been associated with it. Again, yes, definitely the hormone shift can be exacerbating that, but where it's useful to sort of try and think about it from a bigger picture is because there are some things that you really can do something about, and that can be really helpful at making the perimenopause, which can last up to 14 years, a little bit more manageable on a day-to-day. So we had a look here and saw that the thyroid looked normal, but FSH and LH do confirm that there is perimenopause. We did a gut stool testing, which showed that there were low levels of some bacteria which were involved in energy production and also involved in blood sugar regulation. So this is a really good example of how testing can say, okay, so yes, the thyroid looks normal, so any energy issues are not coming from the thyroid, but there is a shift in hormones happening. However, we can also see that from the gut, that there is sort of stuff going on there, and that we can really do something with and really try and work and support the gut there to improve symptoms or support symptoms. So the intervention, we would say, okay, well, we have the FSH and the LH, so let's get in these phytoestrogens, let's get some supplements in. With the microbiome, we saw that there were low levels of specific bacteria, so let's get in certain foods which feed these individual bacteria. You can't buy every single probiotic, they don't all exist. So bifidobacterium you can definitely buy, but actinobacteria and pectinophilus, excuse me, are little, they're not really possible to buy them. So you can have introduced certain foods which feed those individual bacteria. So we did that, and we did find an improvement across the board with symptoms, which was really, really positive. I had someone who was postmenopausal with night sweats and high cholesterol, vaginal dryness, energy issues, and joint pain. So we had a look here to make sure that, again, I wasn't just sort of grouping everything together, having a look around rheumatoid arthritis. So thinking about, is there osteoarthritis? Has there been DEXA scanning? If you've not had that, then push for that. If there's also swelling with joint pain, ask for, CRP, it's called, which is an inflammatory marker, and sort of checking there to sort of see what's going on. So thinking about looking into those different areas, thinking about the thyroid, thinking about vaginal dryness, so that's the sort of vaginal lubricant that I mentioned, thinking about joint pain, but getting started with an anti-inflammatory diet and being gluten-free, which for many people can be helpful with joint pain, and having a look at the cholesterol as well to try and support that. There. So we saw that this person had a subclinically underactive thyroid. So TSH is the thyroid stimulating hormone, and it's basically your brain asking your thyroid to produce hormone. And the range is quite big. It goes all the way up to 4.5, and this person was 2.6, and I usually like it to be under 2. And then T4 is the thyroid hormone itself, and the range there is 12 to 22. So you only have 10 points to move across. So being at 12 right on the level, or 13, can really feel quite significant. So this actually is really validating and can be really useful to kind of do something with, and then hopefully feel an improvement for that. So with the thyroid, be thinking about Brazil nuts because they have selenium in them, trying to get in iodized salt, iodine is important for the thyroid, thinking about stress and sleep support, and thinking about reducing things called goitrogenic foods, which can irritate the thyroid. So thank